Handstütze zeigen, die wirklich super leicht ist. Ich glaube, Sie werden nachher hierher kommen wollen und mal testen wollen. Sie ist wirklich nur einige Gramm schwer. Ich habe die gerade vorher mal getestet und eine absolut geniale Fußorthese. Der Vortrag wird in Englisch sein. Sollten Sie ein Problem haben, melden Sie sich gerne, dann übersetzen wir phasenweise.
Thanks everybody for coming to our presentation. My name is Rafael, I'm INDESmed CIO. She is Gisela Kufus, she is the sales manager of Austria and Germany. We are going to start from our latest patent, worldwide patent. We have several patents. As you may already know, INDESmed produces and develops walking aids and vision aids. And we are today doing the first presentation about the first walker boot in the world that can be adjusted on height and width. On our opinion, this is going to be a game changer because with only one boot you can fit it for different patients, different sizes, different feet sizes, specifically from
Till 45.
okay, so furthermore, to adjust this walking boot, you only need 1 point of adjustment. With only 1 point of adjustment, you will be able to adjust the length and the width. You can explain the tooling.
As you see, it's just 1 point of access where you can change all the length and the weight of the boot. It's a house-made video, as you can see, but I think it's very visual, how you change the length, and at the same time that you change the length, the weight adapts to the proportional length.
Okay, so maybe you cannot see it properly in the video, but simultaneously the boot adapts in length and width. This is the most important point of this new boot. And why we think this is a game changer? Because there are benefits for distributors, professionals. I mean, when one patient comes out of a surgery, for example, he breaks an ankle, comes out from surgery, the ankle will be swollen, so he might need a bigger size than usual. 2 weeks after that, after surgery, the ankle won't be swollen, so he would need a boot of his size. So during the process of healing, all the phases of healing, you can adjust only with that tool the boot to his proper size. Okay, so the main features of this boot are one only adjustment point. It's this adaptable for all sizes, in this case from 37 to 44, which is a huge range. Perfect universal fit, follows the patient healing phases. Perfect immobilization for foot and ankle fracture. Till now all the boots have different methods for immobilization. Air cams, sponge, different methods, but no one of them are suitable or perfect suits the patient. A patient that, for example, have a size 40, have to use the same boot to the person that is using a 45. So other companies or the producers make some different methods, air cams, sponge, whatever, to adapt to the patient. In this case, you just have to use the tool, the doctor just have to use the tool, or the patient just have to use the tool to adapt the boot to the patient's feet. Okay, and understanding why is this possible and the background of this invention, of our patent, to understand it better, we need to know that there are many on the internet available around the world, many studies about the human feet, But there is one very popular that is made by Dr. Chockenham Ray from the Stanford University that was published in 2003, and he made a huge study with many patients, and he concludes that the human feet has a linear ratio between length and width. So a person that has a 45 feet or 45, when you divide the length and the width, there is a constant number, and the same number as a person that has a 36. So when you divide the length and width of a person of 36 feet, the ratio is the same. So this provides the possibility that you can make a walking boot that linearly adapts to all the patients. Okay, I'm not going to enter now in mathematical history, but of course in the company we have made a lot of mathematical calculation and studies to develop this product. Okay.
Exactly, that's what we showed before, that you have just one access point to adapt the length and the width of the boot.
In this image, we are doing it with a standard Allen key, but
you can make
you can do it with
here. Just if you screw in one direction, it opens, and if you screw in the other direction, it closes.
Height can be adjusted. We have made a design that different extensors or pieces can be assembled with easy, quick to put it on and put it off. So the boot can be perfectly adapted to different lengths. Of course, a person with a 45 doesn't have the same leg length that a person with a 36. Okay. So, as conclusions, we can start from this boot that is one boot for all sizes. No stocking. If you are a distributor or professional, you don't have to stock. Currently, most of producers or makers do 3 sizes. Conclusions are that you can use one boot for all sizes, no stocking. That's the best part for distributors, professionals. But the best part for the patients is that, as we said, the boot goes with them in all the healing phases. Okay, and this is very important because we have 2 sides: the side of the professional and the side of the patient.